Okay, welcome everyone. So we're going to be focusing on promoting client experiencing for better treatment outcomes. Any of you know the term experiencing? It's a very specific term in the psychotherapy literature. Maybe you have some ideas of what it might mean, but have you ever heard of it? You want to let me know? Yes, no, maybe. Okay, great. I'm excited. I was hopeful you didn't actually, because it's one of my favorite research topics and actually it does have a lot of clinical implications. So I'm excited to talk about it today. So this is a table that I always love to show also my university students. This is kind of a summary some of our colleagues did, and I kind of edited it a little bit, of therapist skills that are predictor of treatment outcomes. So every one of the items on this list here are things that we know are very much connected to how well you do in therapy, how much you can help your clients. Okay. So like each of these has a lot of research backing. And the first of one, like no surprises, to create a solid therapeutic alliance. As we have discussed before, your ability to align with your client to create shared goals and tasks to reach those goals and a good bond with your clients, right? Which is, of course, a lot easier said than done for most cases, right? So that's the first one. Therapist interpersonal skills, very important kind of research base. And these are kind of very specific therapist verbal and non-verbal qualities that predict outcomes as well. The therapist verbal fluency, meaning how clearly and non-anxiously they can talk. Also a bit how confidently they can talk. Their emotional expressiveness, which we have practiced here a little bit before. So how expressive are you as you are talking? That's actually very important. If you have this flat affect voice, it's very hard to actually do any sort of impact with your clients, right? So modulating your affect is quite important. Empathy skills, positive regard and affirmation towards clients, your persuasiveness and promotion of positive treatment expectations, and degree of collaboration, creating a collaborative environment with clients. Lastly, but not leastly, collecting progress feedback, what can also be called routine outcome monitoring, which at the Sentio Counseling Center we do, right? We collect outcome data every session. And I want to focus on this last item here, which is facilitating clients' emotional experiencing. Now, what's interesting about facilitating clients' emotional experiencing is that it predicts outcome across models, even those that don't traditionally focus so much on the client's emotions. So in 1997 or something, Louis Castonguay and Marv Goldfried did this very interesting and important study where they actually rated the degree of clients' emotional or depth of clients' emotional experiencing during the sessions in psychodynamic therapy, but also in cognitive behavioral therapy. And then this was replicated across different therapies. And to some people's surprises, the degree of clients' emotional experiencing during the therapy session was predictive of outcomes independent of the therapy model. So even if you're doing straight cognitive behavioral therapy, where you're disputing maladaptive beliefs, the depth of clients' emotional experiencing during the session was predictive of outcome. And don't worry, I'm going to be more concrete about what emotional experiencing means. There's actually a way to code for it. But so just to let you know, like there is a lot of research backing on this. And there's a recent paper, meta-analysis, which is kind of when you collect all the data on any topic. Really great researcher from Canada called Antonio Pasquale-Leone. And basically, he did this meta-analysis, which concluded that experiencing seems to be the most promising client process predictor of outcome. When therapist interventions deliberately point the client towards a deeper level of experiencing, clients were found to be 9 times more likely to deepen their own process. Okay. Meaning having more productive meaning making, emotional processing, etc. Okay. So actually, plenty of skills that we're going to be focusing on practicing have in some way, directly or indirectly, to do with facilitating client experiencing. Okay. So what does it mean? Let's make it more concrete. There are different versions of what's called the experiencing scale. The experiencing scale is a very, perhaps the most used process research measure in psychotherapy, perhaps, where You can use it just as a clinician to kind of guide it as a map for yourself, but you can also use it in research. And it basically rates at any point from 1 to 7, what's your client's depth of experiencing? Okay. So let's imagine that you're with your client, right? You're discussing whatever it is with your client. At any point, we could pause the recording, right? Or you could pause the session, as hard as that would be. And you could take out a piece of paper, look at this and see, okay, which level of experiencing am I, or is this client at, more specifically? The first level of experiencing is the level 1, which is the client being objective and intellectual, giving no evidence of personal significance of events being described. It's very unlikely that during a therapy session, you'll ever find a client on level 1 of experiencing, okay? The only maybe departure is with schizoid or schizophrenic clients, that sometimes they will be talking about things that have no clear like personal meaning or no clear personal relevance. Another kind of common example we can use is news anchors. When the news anchor is giving the news, they're talking about something that has zero personal relevance as far as we know. So we would rate them as a 1 on the experiencing scale. Okay. But for the most part, most of your clients will at least, yeah, I would say most of your clients will come into sessions, at least in the beginning, a lot of them on either level 2 or 3 on the experiencing scale. So 2 is the client is describing events that are personal, but in a detached way. Okay. They make no explicit reference to their own feelings, their reactions, their internal states. And as an example, you could say, for example, the client says, I just got fired, right? So it's something personal, but the client may say it in a kind of detached way. There's no explicit sense of like what they're feeling around it, what's the reaction to being fired. We just know something that's happened to them personally. Or I went to meet my girlfriend and she never showed up. Okay. At that level, we're just at level 2, right? Now, I want to remind you, in the depending on where you are, the lower we go here, or the more the experiencing we go into, the more productive your session will probably be. Okay, this is why I'm showing you guys this. At level 3, we're talking about events, still external events, but we're now talking about the reactions the client has to those external events. So, for example, my girlfriend didn't show up to the coffee place, and I'm so angry that she didn't show up to the coffee place. So the event is still in the forefront to a certain extent. The client is just like at the forefront is like describing the event, but there's already a sense of their reaction to the event. Okay. So I want to point out that the first 3 levels of experiencing are usually about externals, right? And you guys may remember that we talked that one of the core things we're trying to do with a lot of these skills is going from abstract to concrete and from external to internal, right? And you can see this here, like the first 3 levels of experiencing, the client is mostly describing external events, right? Maybe in a detached way, maybe giving a little bit of sense of their reactions to those events. The main shift that we're always trying to promote in session is from level 3 to 4. This is the crux of good therapy process. Of course, I'm simplifying it a lot, but I want to draw attention to this jump here from just talking about reactions to external events to making a shift inward with a focus on exploration of feelings and internal experiences. One way of saying it is that they're now speaking from their experience and not just about their experience or about external events, right? So in the example I said before, when the client says, I'm so angry that my girlfriend didn't show up, the emphasis is on the angry, not on the girlfriend not showing up, right? The emphasis is now on the internal experience that's happening, even as they're describing it, right? A lot of empathy skills, validation skills, emotion focus skills have to do, and the more videos you'll see of real therapy sessions, the more you'll notice, have to do with making this jump from level 3 of experiencing to level 4, where your clients are talking more abstractly, more cognitively about something, and making this shift into how it impacts them internally. Right? Any questions so far? Do any of you recognize the difficulty with your own clients of sometimes making this shift, or is it just me? Okay, great. I don't feel so alone. So a lot of clients are perpetually stuck on levels 2 and 3 of experiencing, and without our help, they'll just stay stuck there, basically, right? So a lot of our skills are to make this shift inward into level 4 of experiencing, and from there, we go into more emotional processing. Then on level 5, people start asking questions about their internal experience, which is actually, these questions aren't purely cognitive, right? So I want to draw attention that this scale isn't an emotion scale, although emotion is a very important part of it. It's even deeper than that. It's activating emotion, internal experience, but also making relevant meaning out of that internal experience, right? So it's two. It's the emotion, but it's also assigning meaning to that emotion, right? So as you're starting to explore your inner reactions to something that's relevant, we start to ask questions about, why do I feel this way, right? What does this mean to me? Why am I feeling this way with this particular person in this particular context? This is level 5 of experiencing. As we process this and help people through these questions, hopefully we'll reach level 6, which is the person comes to newly realized feelings. So there's going to be a shift, and those new feelings and new experiences are integrated and explored to produce personally meaningful constructions and resolve issues. More concretely, we've talked about in other contexts that emotions let you know, for example, of the client's unmet needs, right? So if you can really get to the primary emotion of a client, you can then start assigning the meaning of what does it mean about what you need. So if your client is fearful, right, and you can experience the fear in the session and process it, the client will almost spontaneously come to the realization often that there's an unmet need underlying this primary feeling. So if it's fear, for example, it's the need for safety, right? Now that process, like getting to the point where you say, wow, I really need safety in my life, for example, in this particular situation, is a level 6 realization. It's assigning a meaning to that internal experience, right? And finally, level 7 is broadening that specific experience to just a wider range of experiences. So for example, the client may make bridges, realizing throughout all of my life, I've always felt unsafe and fearful. And now I can see that in different aspects of my life, I have been sabotaging myself in this or that way. So it's making a larger connection to larger patterns, basically, from one experience to multiple aspects of their lives. Now, most sessions, you will never reach this level, and that's fine. Okay? Most sessions, you will never reach level 5. Okay? We try, but sometimes it's just very hard, right? Most sessions, what you're doing is you're doing work to be able to go from 3 to 4, or from 2 to 3 to 4, sometimes to 5, which is being able to have the client, by their own volition, their own will, being curious about their inner experience and trying to make sense of it. But sometimes you can stay in a very productive zone at the level 4 or 5 for a long time. Right. So when we do research and we watch videotapes, we can actually assign like these kind of experiencing scale, and we can see like how are people evolving across sessions in this scale. And lo and behold, the higher the score on experiencing, the better therapy outcomes they have, meaning the more personally meaningful behavioral and relational shifts happen in their life. Right. Any questions around this?
So for a client to like fully overcome whatever is distressing them, they would have to reach phase 7 in order to take action. or in order to take productive action or meaningful action? And I'm
Well,
using that word very loosely.
yeah, that's a great question, Natalie. Actually, sometimes it might be the other way around, where the productive action might precede important new realizations, right? And different therapy models might have different sequences here. So, for example, in cognitive behavioral therapy, often you start with behavioral work, exposure work, assertiveness training, whatever it is. That's a way to activate emotion. Like assertiveness training and exposure does get you activated internally, emotionally. And it's through those experiences that then you can kind of put the pieces together and create new learnings out of them and make new meanings out of it, right? So I wouldn't say that only as you reach 7 or 6 do you actually do new behaviors. It actually is a bit more messy, as all things in psychotherapy. What I think it is helpful for you guys as you're seeing clients is having this map inside of you lets you know if you're on the productive or unproductive track. So this is what I meant, and I sent you guys an email before this meeting, that this is one of the most helpful things. Me being a process researcher using this measure was one of the most clinically meaningful things for me. Because now, like when a client is at a level 2, for example, I am just so aware of it. Like it's not like I'm consciously thinking, oh, this is level 2, although sometimes that does happen, but I just have an immediate reaction to that, where I know that this is an unproductive space. And what's funny is I guess you guys also know it. You just sometimes don't have the words for it. But if you see someone in a totally like detached state talking about personal things in a detached way, you know at some point that that's not super helpful, right? So I guess I'm just giving you a process map to put words to it. Right. Yeah,
I
more reactions. Go ahead, Nelly.
I have seen, I think, like looking back on my sessions, I have seen, I think, a certain client go through these, but then go back,
Yes.
trickle back.
Yes.
So
Exactly.
it's
And that,
they have reached 7, being like, okay, I understand. Maybe I feel, I'm having a hard time like building these interpersonal relationships because of my abandonment issues, and I want connection, and I want to feel safe in my connection, and I want to be able to trust people. But then they go revert back to being like, no, I just don't trust anybody.
yeah. So I would be careful with one thing. As we start using this kind of measures, it's easy to overestimate the level we're in. So, for example, the client might say something that theoretically makes a lot of sense. Like, yeah, I can see this and this and this now, but they can do it in a very detached, not informed with their internal experience way. And a lot of clients actually are very, we have a lot of very smart clients who their detached part is actually very smart and they can make cognitive links. That might even be true. Right? And so you hear a client say, yeah, I know this pattern and this happened and this led to that, etc. And you might get excited saying, wow, they're broadening their experience, coming to new realized meanings. Whereas actually, it's a form of detached cognition that might be true, but it's really not getting to the primary visceral experience, right? Speaking from that, right? So this is why we want to make the sequences. We do want to make this mark shift inwards before taking too seriously any sort of meaning making that's being made. More questions, comments on this? Okay. So just a short kind of another little map that goes along well with this one. This is an emotion-focused formulation. Rhonda Goldman and Les Greenberg came up with this for case formulation in motion-focused therapy. I could have shown you a lot of different formulations, but I'm just showing you this just to kind of go along with the experiencing scale. So hopefully with higher levels of experiencing, making this marked shift inwards, focusing on their internal experience, you're helping the client to stay with their core emotions, be them adaptive or maladaptive. And as we said in some other contexts, it's really there that we want to be at their core emotional space, because that's the only space that's really connected to the client's needs. So the more you can stay with their internal emotional experience, primary emotional experience, the more you get a sense for what are the client's unmet needs. And that's very helpful information for treatment planning, of course. But as you're doing that, you'll run into interruptive processes, a part of the client that's kind of interrupting them from experiencing, right? Or they might jump to secondary processes, for example, being guilty about being angry, right? A secondary emotion to their primary emotion, right? And so if you notice, interruptive processes kind of keep you at a low level of experiencing. So if the client basically minimizes their emotions, for example, and says, well, I guess I'm angry at my partner, but it doesn't really matter. Who cares? Right? That's like edging at something productive, but then going straight back into personal and detached, right? Straight back to lower levels of experiencing. So if we're keeping this kind of these maps in mind, we're trying to help the client make a shift from their interruptive processes, interrupting their experience, to a more core emotional experience, right? Which will, again, help us create new meaning making, including like what they might need in their life that's different, right? So how does this connect with the lower practice? Okay, this is my attempt to jump from the broad map to the micro. One of the main ways in which we make a shift from external to internal, this shift inwards, is there are many different ways, is to invite our clients to stay with their emotional experience in the here and now. Which might sound simple, but actually for a lot of clients, they will never get a chance to do this with the exception of being with you guys. Like most of your clients, family members, peers, or whatever will not help them stay with their internal experience for long enough to create productive meaning making, right? So for this skill, we have 3 criteria, the third being the most important one. But the first is to focus the client on their emotional experience in the here and now, whatever it is that they might be saying, to validate the client's emotions. And by the way, I want to make a parenthesis here. Sometimes this is not appropriate. Like sometimes you'll just switch from the first criteria to the third criteria. Like sometimes you don't want to break the flow of making the shift inwards by stopping and making long validation, is what I'm saying. But as you're starting out, if you have a client that you haven't done this type of work before, it's usually helpful. So for today, we're going to be doing the second criteria of validating the client's emotions. And then third criteria, invite the client to stay with their emotional experience. Now that can be a bit vague, so I want to give you a tip. One of the best ways to explore emotional experience is by focusing on the here and now bodily sensation. Okay? Because emotions really are physical bodily experiences. Okay, so if you make that shift inwards to the bodily expression of those emotions, you're helping clients stay with and tolerate their experience instead of avoid, which might be their go-to, right? So let's see an example here. Vanessa, could you please be the client? And David, could you please be the therapist?
Okay. I'm sorry, I had to minimize you guys on the side. It was blocking the screen. Um, I'm so sad and lonely. This feeling is unbearable. I have no one in my life I can count on. But I guess there's no point in even complaining about this.
You're feeling sad and lonely. This is so understandable, given that you feel like there's no one in your life. Can you try to stay with these feelings of sadness and aloneness? How do you experience them in your body right now?
Great, thank you both. Notice in the client statement at the end, but I guess there's no point even in complaining about this, is an inkling of an interruptive process, right? I'm sad and lonely, but no, it doesn't even matter, right? So what you're doing is you're helping them as far as possible to bypass this interruption and stay with this core experience, right? So, and the major intervention here is the third criteria again. So can you try to stay with these feelings? How do you experience them in your body right now? Right? And again, the reason we're doing this is we're trying to make this shift inward, where instead of just describing in a more detached way or moving away from their experience, we're trying to first focus them on their bodily experience, right? That's the first major step, right? With some clients, you will need, of course, different skills, additional work, but for a lot of clients, this is really the first step in making this shift inwards, right? Any questions before we move on?
So what happens if a client, because this has actually happened to me, what happens when you ask the client, what are you experiencing in your body right now? And they say, and then I went on to be like, okay, let's give it a minute. Let's take a deep breath. What are you experiencing now? And they keep on saying nothing.
Great. So how would you conceptualize that? Where is that in this map?
Is that the interruptive process of not wanting
Yes.
to feel anything?
There's only one type of people who feel nothing, dead people. Okay, you might feel bored, right? You might feel frustrated, but you're always feeling something, even if it's at a low rise, at a low intensity, right? So when you hear a client saying nothing, the most likely thing happening is that the client is in a detached mode or interruptive process, right?
Okay.
With some clients, just this little nudge will help them go from the interruption to more experiencing. So a percentage of our clients just need the nudge. Another percentage, maybe even larger percentage, need the nudge as a first step, but then need to learn about their interruptive processes, right? And that's where you, for example, might start doing parts work with their interruptive process, right? But your first attempt is to bypass an interruption. And an even lower percentage of clients have very little interruption. For example, clients in grief work might be just there with the emotions, and you can just jump right in. So invite them to stay with their internal experience, and they are very little defended, and you can just smoothly go into that, right? Did I answer your
I
question?
remember
No.
using
Yeah.
sorry. I did use this also with like one client of mine, where I expressed, I invited him to stay with his emotional experience, and I told him to like pinpoint where he's feeling it on his body, and he said, "Oh, it's in my chest and my shoulders and a little bit on the back of my neck." And I was like, "Okay," but after that, I didn't know where to go, so I was
Right.
all like, "Okay, that's cool." Just kidding.
Yeah. Okay. That was a great job. Great first step, Vanessa. No shame there. Great work. So I also want to say this, that when you're asking what they're feeling, it has to be in relationship usually to something, right?
Mhm.
Right. They might be feeling something in the room with you, which you can explore, but you also want to make sure that are they activated at all? Are they activated about something? So if you're exploring your feelings towards a person or an event or something, as you explore the inner, you can start to make those kind of meaning makings that we described before. So instead of you getting stuck like, oh, great, so you feel this in your body, right? Like now you're feeling a tenseness in the chest, right? As you stay
Yeah.
with that, right, you can start to also invite the client, let's go back to the experiencing scale, to be curious about that experience, right? Why would they feel this tense in this particular situation? So for example, client feels really stuck and tense and anxious just being in front of you. Why would that be? Can we create curiosity about that? Because that's probably telling us something important. Or maybe they feel really angry towards someone, right? And they explain how the anger feels in the body, right? And as you settle into that experience, we can start asking questions about it, right? Now you could say, well, I could ask the questions before staying with internal experience, but this is the issue, is asking questions cognitively in a detached way is very different than asking questions from an activated emotional space.
Mhm.
The kinds of information and responses you're going to get are quite different, right? So if someone is crying over sadness over the loss of something and asking questions around that is quite different than someone detached in a very detached state talking about some loss.
Yeah. Is it safe to use this with people who are like dysregulated?
Yeah. One way in which you regulate clients actually is through this shift inwards. So if a client is very, very anxious, actually running away from the anxiety is keeping them more dysregulated.
Okay.
So one
Yeah,
of the
because
most
he
regulating
would all
techniques is staying with the present experience.
okay. Yeah, because he would always, cry every session almost. And he would express that he was feeling dysregulated. So I didn't want to use it too much because I didn't know if it was causing more harm than good.
Yeah. What might then we have to like, there's other considerations there because like the extreme crying might be a secondary emotion, as weird as that might sound. Sometimes you might cry as a secondary experience to, for example, being angry or guilty or ashamed about something, right?
Okay.
David.
Yeah, I was actually wondering about that, about how if there's any guidelines for distinguishing secondary emotions from core emotions, because like sadness can cover anger, but anger could cover sadness. And
Primary
it's not
emotions are gut reaction emotions to the event that's triggering them. The classic example is if a lion shows up here in my room, hopefully I'll have a core guttural experience of fear. whereas secondary are emotions in reaction to emotions, right? So that's the way you know the difference between primary and secondary. Now, inside of primary, there are also distinctions. There's primary adaptive and primary maladaptive. Primary adaptive being the gut sense that all of us would have, regardless of who our past history. So hopefully every one of us, if a lion showed up here, would have that core fear, right? But people also have maladaptive primary emotions, which are personal to their own traumatic experiences. So for example, I might have a primary fear of relationships. That's primary, right? It's a gut reaction I have anytime I go into a relationship, but it's only me who has it. Not everyone in the room would have the same experience. And it's due to my personal history, right? So that would be primary maladaptive, which would want to stay with and explore, right? The way out is through going through that primary maladaptive. The secondary reaction is something that you can kind of pick as you start going through it. You can kind of understand at a certain point that it's actually not letting you into their gut reaction of a certain relationship, a certain event. Did I answer your question, David?
Yeah, thank you.
Great. All right. So let's very quickly
But
do.
would this
Oh,
work with antisocial?
sorry, Natalie.
But you wouldn't use this with like antisocial.
The question is not really would you or would you not use it? Because I think this is also a good assessment tool. I would encourage you to use it and see what happens, because you will learn from the people. Like if you use this and you smash into an interruptive process, that's good information for you as a clinician. So the question isn't really should or should you not use it. This is an intervention and an assessment that you're doing at the same time, right?
Got
So
it.
as you ask them to stay with their internal experience, if someone just says, I'm not interested in going into that, that's helpful information to know, right? So rather than thinking, is this the right or the wrong intervention, think it both as an intervention and an assessment.
Got it. Okay. But obviously, if you notice that something's off, you wouldn't keep using this. You would move on to something else.
Exactly. That would be a marker that we have to do something different. Yeah. Because again, with some kinds, you can bypass those interruptions fairly quickly, but with more rigid interruptive processes, you actually have to go straight into the interruption. You have to work with it directly. You can't bypass it. Let's see an example, and I'm going to ask your guys' help. I have a small clip here, and we have these 3 criteria: the focusing on the client's emotional experience, validating the client's emotion, inviting the client to stay with their emotional experience. I'm going to go over this. I'm just looking at my screen here. Natalie, I'm going to show you this clip, and at the end of the clip, I'm going to ask you to try your best to answer it. Okay? And don't worry, you have help from the assistants, so you can get some peer feedback. Okay, ready? Oh, you gotta unmute yourself.
I'm ready.
All right, let's go for it.
My daughter recently left for college. And my husband died last year. I'm all alone at home. I really feel sad and lonely.
So I can see that you're feeling really sad and alone at the moment, especially with losing everyone. Anybody would feel that way, especially if they lost people that they cared about. I was wondering, what do you feel right now? Like how does your body feel from feeling this alone?
Great. So great focus into the experience, great validation, right? And that third criteria there, you got there completely. Congratulations. So you start that kind of vague, right? How do you feel kind of more generally, which you can do, right? I'm going to invite you to just try it again and be even more concrete as you did at the end. Let's try to just keep it a bit tighter. The sadness and aloneness, can you feel it right now? How do you experience it in your body right now? You want to try that?
Okay. So I can see that you're really feeling alone and sad. And anybody would feel that, especially a mother who, you know, their child just went off to college and you just lost your husband. I was wondering, what does that sad and loneliness, how does that come about in your body right now?
Okay, let's try it again. Just focus on that first criteria. You're doing fantastic. This is why we do the little practice, right?
I can feel my brain just go, no.
Okay, say it with me. How do you experience this sadness and aloneness in your body right now?
How do you feel the sadness
How
and
do you
alone?
experience this sadness and aloneness? How do you experience?
How do you experience this sadness and loneliness in your body right now?
Beautiful. Yay! How are you doing, Natalie?
I'm sweating.
Good job. Great
Okay.
job. Okay. Does it make sense why you'd ask this question?
Mhm.
Yeah?
Yeah.
Great. And so here's a clear example of a client kind of handing it to you, right? Here's an emotion, do something with it, basically, right? This is the best case scenario, I would say. Let's try a different scenario. Jen, I'm going to show you a different clip here. And let's try it. Go, Jen.
I feel like I'm running. I can't. I can't just sit and.
That's it.
Yeah, it's what I'm hearing is that you're feeling really restless and maybe anxious. And I'm wondering, as you're feeling that restlessness and anxiety, what's happening in your body right now and what you're feeling?
Beautiful, Jen. Beautiful. And you even did something that I didn't mention, which is in this case, it's hard to validate because you have so little context, right? So I'm glad you did that jump. So notice here that the client non-verbally is quite emotionally activated. So that's the clue here, but they're not actually saying it, right? So this is a different scenario where you might use this technique. Is the nonverbals are letting you know, let you clue in. You did what's called an empathic conjecture. You're conjecturing what they might be feeling, right? Probably restlessness, anxiety. How do you experience that anxiety in your body right now, right? Which is the last thing most anxious people want to focus on, and yet it's the thing that's going to regulate them the most in the long term, right? How's that for you, Jen?
I was nervous about whether I got the first part right in terms of what she was experiencing, and I wondered if I didn't get it right, what that might be like in
You'd
the
get
session and how to
feedback.
handle it.
Yeah, the good news is, yeah, probably the client would let you know and you could work from there. This is the beautiful thing about empathic conjectures. The client will probably let you know. But great, you're making this shift inwards. And notice again, thinking about the experiencing scale, right? That the client, although they're not mentioning here, if you were just to read a transcript, it could also almost come across as detached, right? But actually, there's all these markers that kind of clue you into how you can make the experiencing level higher, which is, okay, there's some emotional activation here. Can I nudge it in that direction of internal experience?
You get the sense that she's trying to run even now from how she's feeling.
Yeah, bingo. Yeah. And by the way, this is a colleague of mine that we filmed this in Lisbon here, and this is based out of a real generalized anxiety patient I had. So all these clips are based on patients I had. I had tapes of them, and so yeah, these are all verbatim, which is cool.
It felt real.
Cool. I'm glad. All right, let's just do one more. And Daniel, are you up for this one?
Oh, this guy's intense.
All right. So this is a different kind of challenge. So we had the first video, which is client just outright says what they're feeling. Next one, the non-verbals are kind of cluing you in. Let's see how you do with this one, and then we can discuss.
I'm not sure what it is I'm feeling right now.
That's it.
Yeah, and I hear that you're feeling this sense of, numbness or, nothingness. And that can happen, especially when you've been through what you've been through. So I'm curious, while you're sitting here and you are feeling numb, is there anything that's coming up for you in your body that you can kind of contribute to this?
Okay, great. So you're making there a risky conjecture, which is that they're numb, right?
Mhm.
It's possible. What I'm hearing is the client is feeling something but can't assign language to it. They don't know what it is, right? Let's hear the clip again.
I'm not sure what it is I'm feeling right now.
So this is very different from saying I'm not feeling anything. The example one of you said before, right? If the client said I'm not feeling anything, you could say, well, maybe you're numb, right? And we could explore that. He's saying, he's kind of moving his body and saying, I'm not sure what I'm feeling right now. Good news is you can actually promote this staying with emotional experience even at this level of abstraction. So you go, yeah, so you're unsure about what it is that you're feeling, even though something seems to be coming up. Right? Can you just stay with that amorphous thing that's coming up? And just take a moment and see, how does it feel in your body right now? Right? So it's almost like a judo move. There's something there. Okay, we don't have language for it yet. That's fine. And you can kind of play around with it. Yeah, there's this kind of amorphous sense, right? Not really sure what it is. Stay with that. How does it feel in your body? How's that for you, Daniel?
I think I know what I'm gonna do.
Okay, cool.
I think.
Let's
We'll see.
try it. Let's give it another try.
I'm not sure what it is I'm feeling right now.
Yeah, I understand you can't make sense of what's going on, your body and what you're feeling. Um, and maybe we can sit with this just for a little bit. And maybe you can explain, what's coming up for you. If anything. Huh.
You're doing so great. Okay, here's
Oh,
where I
yeah.
think let's help you out with this. The word explain is dangerous because explain
Okay.
is cognitive, right? So instead of explain, try notice. Try to notice what's going on.
Okay.
Right? Because notice is like being curious about internal experience. Explain is like cognitively based, right? So just do the last criteria. Okay, just try the last criteria.
I'm not sure what it is I'm feeling right now.
And that's okay. Let's sit with it and see if we can notice anything that comes up for you. Just while we're sitting here.
Great. Again, we're really nitpicky here, Daniel. Okay,
Yeah.
you got the hardest clip, so I'm going to be nitpicky. You use the plural. Let's stay, right?
Got it.
Invite him to do it, right?
Got
Can you notice and stay with it?
Okay.
Right?
I'm not sure what it is I'm feeling right now.
And that's completely okay. Maybe, we can sit here and maybe you can notice something that comes up for you just while we're sitting here.
Right. So you're saying maybe you can sit here, right? I would be more directive, really make an invitation. Can you try and stay with that, right? And see how it feels in your body. What do you notice in your body right now? Say it with me. You try it without the video.
Yeah, how about you sit here and see if we can notice anything that comes up, through your body, so anything that you feel coming up for you.
Great. Right now.
Right now.
Great.
Okay.
Try it again.
Yeah, so I'd like you to sit here and see if anything comes up for you in, these feelings that you're experiencing right now.
Yeah. Again, the directive. Can you try it? Right. So so you don't really want to let them off the hook. You really want to make an invitation, right? Can you try to? I would invite you to try that.
Can you try to sit in? Okay, I'm gonna restart this one.
Yeah.
Can you try to, sit with these feelings and see if anything comes up for you with what you're feeling right now?
Great. Great job. How's that for you, Daniel?
Can you try to sit with these feelings and, see if something comes up for you right now? Yeah, that feels better. It's getting easier.
Great work.
Thank you.
Awesome. My pleasure. Thank you to our three very courageous therapists. Nice. I do want to go into a break because you guys totally deserve it, but I just want to ask 5 minutes of your time and then we'll go into a break. How was that for you? Any questions, reflections around anything we discussed? Also this last bit.
I like how we
I can-
switched it up. Like, I think it was like really useful and beneficial to see it differently than just to see things written on a sheet and trying to come up with answers.
What
And
was
then
helpful? Can you say that again, Natalie?
I think it was helpful seeing the video and interacting with the video, and then also getting like your input on it, because sometimes I feel like when we're reading things off a sheet, it's like, okay, how do we answer this? And it's just like, I
Gotcha.
think that I don't want to say shame, but it's just like the embarrassment is like, okay, let's just move on to the next instead of actually diving a little bit deeper into it.
So this back and forth helped.
I think that helped a lot.
Okay.
Or I enjoy it.
Jen, you were gonna say something?
I was just gonna say I can't wait to use this technique.
I wanted to say I liked how you at times provided the coaching of kind of just inviting the therapist to repeat what you said, because I know there's times when I need that level of support to learn a new skill. So I'm actually going to take note of that and bring that to my supervision and say, this is what I need sometimes.
Yeah, the modeling, sure.
Yeah.
For mentioning that. Yeah.
I really liked how we did like almost like a little crash course lecture and then went into the skill. Like I felt like it was helpful for me to like understand where the skill was coming from and why it's helpful and like where we're trying to go with it. So I thought that was really helpful.
Cool. Great. So hopefully this is a system we can keep if that feels good. Yeah. Vanessa. Yeah.
I mean, I also like what Natalie said about the video and you being here while we do the TV practice, because, you know, breaking off into groups is good, but sometimes we don't have a supervisor there. So we're all like, do we do a good job? And they're like, yeah, you know, even though like we missed or something.
Yeah, sure.
So we just want to move on to the next.
Yeah. Ideally, you'd always have someone there helping, right? Yeah, yeah. Yeah. And I know the example therapist responses help, but sure, this is even a different level.
And I think that even talking about like, okay, so what happens if they say that, or what happens if they go in this total different direction? Like, what would we do then? Is very helpful instead of
It's
just
like that map, right? We're talking about. Yeah, yeah. Right. Yeah. Although you notice that my response will always be, then we need a different skill, right? We can talk about the broad map, but yes, then you need to practice a different thing, probably. Yeah.
So I noticed with one of my clients, like talking to Tony, it's like I was trying to do what we were doing and working these interventions, and he's like, "It's not going to work with this person. Like, it's not."
Yeah.
And I was like, you know, I was like, "But this is what I've been."
Yeah.
Yeah.
I was gonna say I agree with everyone, but I also really like seeing how other people do things. I think it helps me because I can kind of pick apart what I want to take. So I like being in the big group because I like, seeing, Jen, Michaela, David, Natalie, everyone do their own little thing.
Nice.
And,
Yeah.
And Vanessa.
I like it too. Cool. All right. So this was really fun. Thank you guys for everything. Let's take a 10-minute break. So we'll come back at minute 15 and we'll do a short practice. Okay. See you soon.